Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know why patient-centered care is a disservice, you need to tune into this episode. Before I go on to the podcast, what is new and better with life? I just celebrated my two youngest kids' birthdays over the weekend. So it was a good time in the pool and just relaxing. Jacob just turned 2 and Alex just turned 5. What a joy, what a ride. So it was good to hang out with family and friends. My wife did an amazing uh, theme of Mickey and Minnie Mouse, so that was great. My son Zach is doing awesome, enjoying jujitsu, and he is graduated kindergarten. It's a big deal. So he is home for the summer, so excited to have him inside the house. But other than that, life is great. Training wise, is I'm going consistent. My cap has been better. I'm gonna knock on wood somewhere. And then yeah, it's been a good time with my wife, just hanging out and truly enjoying life at this stage of our year. So it's been great. Especially knowing, if you've listened to my podcast in the past, how much chaos has been happening in the first start of the year. So it's good to have a little bit of stability before more madness starts. I'm sure you can feel that inside your own life. Okay, on to this podcast. So why are we talking about this? So all right, if you were on my those of you on my mentorship academy, we just had our call last Thursday. And it was a topic that I brought to the group that I wanted everybody to process. It's something I am working on with my staff, my team, and anybody that I mentor. And there's this big kind of push in our profession towards patient-centered, right? Patient-centered, patient-centered. And I brought it to the group and I said, uh, it shouldn't be patient-centered. And there's a big difference. And no, this is not semantics. This is real. It's how you view what you do and how you do it. It shouldn't be patient-centered. It should be people-centered. And let me explain why. So we were talking about the group, and our whole entire profession, whether you're an orthopedic clinic, insurance-based, cash-based, professional, sports, whatever you call whatever industry you're in, you'll realize more and more that as you work with people and patients, that the way you treat them will dictate what their outcomes are. And what I mean by that is our profession pushes patients, and patients have injuries on a shoulder, a knee, whatever it is. And patient-centered really pushes us to direct how to reduce that pain from that region. Yes, that's patient-centered, all about them. Well, what happens when, say, that back pain is from training improperly, deadlifting improperly, squatting improperly, picking up their kids improperly, or just being that they're too weak and they don't have the strength to do that, right? So patient-centered would be, okay, let's fix your back, get it strong, do all these other things, work on the mechanics, blah, blah. But what happens when the real root of that whole problem is beyond you? It needs to be fixed with strength and conditioning, it needs to be with work ergonomics. You actually have to put time into ergonomics, where they're picking up their kids, getting out of the car, beyond normal, like manual therapy or modalities or whatever it is that you use in your clinical practice. And patient-centered is that we work towards fixing somebody's back or region. People focus is, can we go beyond that and figure out, is this something that we can actually make a long-term permanent change? But that might not happen inside 4 to 6 visits. Is there a way that we can help somebody from a holistic standpoint address more than the back pain? Because we know that there's several layers to that. And so when we advocate patient-centered, we're kind of fueling this thought process that we should be region focused. And when we go people focused, people centered care, it gives us more of a comprehensive, holistic, multidisciplinary approach to somebody's long term management. So this comes from a conversation that I've had with my groups, with my staff, and ultimately it's because I continue to see people, and specifically sports PTs, who their attention goes towards whatever a patient says. And what I mean by that is you are a big part on why people get better. They come to you with trust. They're like, hey, my so and so has been, flared up, and I really need your input, right? So they come to you with trust. And then you're like, I can help you with that, right? And then they say, oh, by the way, in addition to my foot pain, I also have shoulder pain and back pain and a little bit of knee pain, right? Now, they're not doing anything mean. They're trying to get the most out of how to fix themselves. But you as a PT don't see the opportunity that you have. You're like, well, I'm going to fix this foot, okay? And then they tell you, well, I want to work on my neck. I want to work on my back. And maybe you get distracted with that. By the end of their care, you're like, oh my gosh, I didn't even do any of the foot problems. I worked on this other stuff. Or I'm just going to work on your foot. I can't help you with your back. That would be patient-centered, right? Where you're just looking at regions and why you just looking at fixing little pieces and hoping that fixes the whole part. Now, as you work with these individuals, if you allow that to happen, you're going to let them drive the entire relationship, meaning they're coming to you for trust. They don't know enough. And if you let them override what you want to get accomplished, you as a professional, your job is to set a path, a plan of care so somebody understands this is what it's going to take you to get better. And so that's like an athlete. Maybe you're coaching I imagine I'm going to coach Zach's soccer or baseball team, right? And I know that they need to get better at swinging the bat and catching. And they say, well, we also want to get fast. But I'm like, it doesn't matter. You got to be able to hit the ball and catch the ball. And those are my focuses for the next month. And they say, well, no, we need to get fast at sprinting. Can we play some games? They get distracted. And if I let them take over my goals, of course, we're not going to conquer it. We're never going to get down that path. We're never going to win a game. We'll never get to the destination that we want. And so a lot of times, patients will try and drive the relationship, but you need to understand that it's your role to set that plan and don't get distracted. Now, there's another piece to this. The other piece to this is that a lot of times you will figure out that we're so heavily focused on pain that we can conquer that pain. I think we can do that in our sleep nowadays, right? It's really simple, really straightforward. But are there other things behind that that are continuing to cause their back pain? So, for instance, somebody who you know that they have an instability problem, you can fix their problem with, a little bit of uh, neuromuscular education exercises, a little bit of balance, a little bit of glute strength, whatever you want to call it, a little bit of mechanical improvements. Now, most people develop pain because it takes years to get to that point, maybe months, and you're really good at managing pain, and you're like, oh, 6 visits, I got you out of pain. But in the back of your head, you know that there's a main problem behind that, in that they really, to really lock in that stability, they're going to need 6 to 8 weeks of true strengthening, 6 to 8 weeks of hypertrophy, and that would reduce their pain for a longer term. If not, they're going to be coming back in 6 to 9 months because that thing is just going to become unstable again. It's going to continue to have problems. So if you know the real root of it, your job is to communicate towards them and say, this is what I need from you. Long term, this is going to be the benefit. And ultimately, you have to be honest and truthful about your path and drive that down them. Now, if you know that they need additional resources, it is your job and your role to explain how you can help and at what point it's going to take for them to fully commit and the additional resources or programs that they need to support that. So what I mean by that is, let's take the person with the back pain and they need a strength program, but maybe that's not covered inside PT. And you say, well, it could get them better, but I don't know if we can offer that here. If you focus on a region or pain You are a patient-centered PT, and that's great, but it's a disservice to actually taking a people-centered approach, which would be, I understand your back is in pain. It's going to take me 6 weeks or 6 sessions to get you out of that. And I know that this is the real root underneath being unstable. However, you need additional strength training programs or fitness or conditioning or weight loss or nutrition or whatever it is. And the ideal world to get you out of this pain would be taking that next step. From there, it'd be ideal if you could then work on a maintenance program where we have a remote training program for you. Every month we address it, we fix it, and then that way you can start squatting without pain, deadlifting without pain. But this is not only, I can get you out of pain, but that's that first level. And I know you're going to feel good and be tempted, but you're going to keep coming back every 6 to 9 months. And if you can't understand that, you're going to constantly be in pain. I could only help you so much. That would be a people-centered approach of you're actually hitting the things in their life that they can actually improve upon versus just the small things that will get them out of pain. Now, that might make you proud and happy as a PT to get people out of pain. You're like, oh, I finally did it. I did the thing that I was supposed to do. I did my job. That's okay. Patient-centered is the first step. If you want to expand beyond that, you have to move into a people-centered approach. What happens when they're out of pain? Where can I move them to next? What's the one thing that if I did this, it would reduce their back pain from coming back significantly? That one question, process that, right? Wherever you're doing, you're driving, you're lifting weights, whatever you're doing. Ask yourself that question. If you had an ideal scenario from the beginning of unlimited sessions with somebody, what's the thing that you would do once you got them out of pain to keep it from coming back? Think about that. Would you do an injury prevention program? Would you do a strength program? Would you do a conditioning program? Would you do a nutrition program? All of us have different frameworks on how we would do that. But nonetheless, that question gets you thinking, wait a minute, what would I do in an ideal scenario if I had unlimited visits with somebody? Which route would you take them? Well, that's patient dependent. I get that. But the first thing you thought about right now is once they're out of pain, what's the next step? And that's people-centered. That's not a patient because the patient is no longer in pain. Now they're a person without pain. Now you're actually looking at how do I keep them from coming back to see me 2 times a week? And now how do I keep them active so they don't have to do that? That is the difference between people and patient-centered. And if you can move your thought process around that and you can be honest and convey that to the patients you see, you will have a memorable impact, a significant impact that no patient would ever stop seeing you forever. Why? Because you're the first person who actually cared, who actually said, I know that pain's going to continue to come back. I want to make sure that doesn't come back and put you in the same position that you did that you started. So the question is, why haven't you done this in your clinical practice now? Stated otherwise, if you had unlimited visits with every single patient you saw, what would you do differently and why? This is the conversations that I was having with the PT as a mentor. And it's a tough question. You're like, wait a minute. What would I do? What's a dream scenario? What would you do? Man, I would personally develop a strength program right from the beginning, work on the mechanics and the blah 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 stuff that gets them out of pain. Pain is easy. It's boring to me. It's like straightforward. The real root is how to keep it from coming back. That to me is the art, absolute art, because so many variables, right? They have kids, they train at a gym, they go to CrossFit, they do Orange Theory, they do running, whatever it is. So now you have to learn to control those variables. Well, I don't know how do I control those variables? I don't know. What if it's a weight loss thing? Well, you just got to get them moving more. Well, how much more? Well, that's the root of the question that you need to be asking yourself as a sports PT. How do you address the things, the variables outside of pain? That's what a really good clinician is going to do anyways. So if you can get your lens, your narrow lens of patient-centered, and open that up to people-centered, now you're flying. Now you're in a different direction. So let me give you some tips. Okay. Uh, this was a statement that I really appreciated by somebody in the group, George. He said, Chris, I get what you're saying. I understand it. I really appreciate the term patient for life. If you've heard my podcast, I'm all about that. Patient for life. Not that they're going to be in pain for life. It just means that they're going to go through aches and pains throughout their entire life. And I want to support that patient throughout their life. Meaning, maybe not patient for life, maybe patient throughout life. I don't know, whatever phrase you want to use. But you can't tell me that you currently, maybe you're struggling with knee pain. In 2 years from now, you might start, I don't know, playing club volleyball and your shoulder starts hurting. And then you start to decide you want to do a half marathon training and you develop foot pain. You want to get that fixed. Well, what if you get in a car accident and you have neck pain? You want to be able to get that fixed. You want to be able to go, no matter what body part, patients want to see the same person or somebody that they can trust. Why wouldn't that be you? So patient for life just means I want to support people with all the aches and pains that they develop, and I want to be able to support that. Do you think that your patients know that you can do all those things? Or do they think that you're the shoulder expert? And if they think that you're the shoulder expert, you focused on a patient-centered approach. People-centered approach is, listen, I understand you're a human. You're going to be injured your entire life in some form or fashion. You will have aches and pains throughout your life. I can treat that. Here's what I would do. Blah, 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 blah. And on top of that, we can also reduce the risk of those things happening by keeping you fit, getting you more fit, reducing how much you do, improving your lifestyle, working on nutrition. Maybe you don't offer those inside your clinics, but start thinking about, in an ideal world, maybe you have people who move too much and you have to slow them down. Maybe they don't move enough and you need a couch, but they have a couch potato and you need a fitness program. Why don't you build one? Why don't you get your inactive people more fit? And why don't you actually address the elephant in the room and actually inform them of programs that might benefit them to reduce their aches and pains and bilateral knee pain and back pain because they just need to move more, not the fancy exercise that you're giving them. Why don't you just be honest? And if they can understand that, wow, I just need to move more. Well, is that really PT? No, let's get you on a fitness program. And all you have to do is show up once a week, come to the clinic. We'll run you through an hour worth of stretches and basic movements to get you on the right path. That's going to fix their knee pain, not a little bit of whatever exercise you're going to do. That's only temporary because you got to get to the root of the problem. Why don't you just be honest? So patient-centered is going around it. You're not fixing the root. Yeah, you finally fixed the shoulder, but that's only going to last so long. It's their awareness of their body. They need to work on strength programs. They need to work on fitness programs. They need to lose weight. They need to gain weight. They need to work on nutrition. This is, I think, the direction that physical therapy is going to go, is being an adjunct or building multidisciplinary facilities where you can support people through this process. Now, if you keep becoming the shoulder expert, you're going to be stuck doing the same thing, being patient-centered. Now, if you really want to say, the reason why I bring this up, because there's a lot of people on this podcast and across the country who feel passionate about being able to provide a wellness service, being able to provide something bigger, better, stronger, because they have a passion for people, a passion for making a huge impact in people's lives. And if you stick to region-based approach, body part-based approach, you'll be stuck in a patient-centered approach. If you're looking for more and you're like, I want more, then you got to stop thinking like that. I tell you this because I lived it. I've worked in professional sports. I've seen it where you take a human and you take this athlete and it's just like, it's not even patient care. It's just, what do you need for the year to be active? But because we live in this box of a clinic and we're told to do these things, we just don't open our brains up to like, what do people need versus what does a patient need? And I need you reframing that and understanding that people seek this, they want it. And the challenge is you're stuck because your lens is stuck inside body regions. Take a bigger approach. So if you ask, okay, so wait, okay, so I'm in now. I want to do more. Tell me, how do I do this? All right, so here's a couple places you have to start. Number one, the first thing you have to do is you have to inquire about their fitness. There's 4 domains you have to ask. Ask about their fitness. What do you do for exercise? How often do you exercise? Right? All the normal questions of fitness. Then you have to also ask about their home environment. Tell me about your house. How many steps? How active are you at home? Do you have any kids? What's your like home life like? So I understand how busy you are, how many steps you take, what's your outline of everything you do. So I know what you do at the gym. That's one domain, or outside. I know what you do at home. What's the third one? Work. Those 3 domains will tell you a lot about a human, right? So talk about home, talk about exercise, talk about work. Then you understand their total volume of work across a week. So if you ask about, all right, what do you do for fitness? What's your home environment like? What's work? Do you sit all day? Blah, blah, blah. Do you stand all day? Are you very active? And the last one is their health. Tell me about like your diet. What's your nutrition like? What do you do? Like what type of, do you drink water? How often do you sleep? You start having those conversations. So if you can understand those 4 domains, you understand work, you understand home, you understand fitness and their health. Now you have this quadrant where you can really support people with whatever they need. So if you can't ask those questions, you'll always be stuck in a patient-centered approach. And why is that bad? Well, it's not bad in that you are not getting outcomes, but your outcomes will be limited. You're not moving on to the next step. You're going to always be stuck treating one region by one region, by one region, by one region, by one region. And what happens is you don't have the opportunity to truly help them at a different level. So ask about all 4 of those domains: fitness, home, work, and health. Then you have to figure out what's not ideal. They're like, well, I don't exercise. Okay, let's talk about that. So once you ask those 4 domains, ask or figure out what's not ideal. And what's the solution? You address the not ideal. And PTs we're big on being perfectionists. Well, like how do I write it perfectly? Like how do I write this? It doesn't matter. You just gotta get started on the conversations. Just trying to figure out, okay, how can I help? Okay, great. That you only jog 1 time a week. How about we up that to 2 times a week? Is it possible? What's your work environment? Can you do a standing desk? Can you just start attacking more than the region, because that's a patient-centered approach. Now you're talking about human, the person. So address the not ideal. All right. I wrote this down. Get rid of the pain so you can actually work on the problem. If you say that again, get rid of the pain so you can actually work on the problem. The problem led to pain, so you solved pain. So what's the source? What's the real root? PTs, we don't think like that. PTs, we think that was the root. No, 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 no. That took time for that to accumulate. And it wasn't because they had weak glutes or stiff this. It's because there was a lot of factors that came towards that. And if you rely on a patient-centered approach, you'll always be stuck. And I want you to understand pain is the thing that we're tied to as a profession, but it's like the first layer of the onion. You got to peel that to see the root. And I think you truly have to have different paths to help people. Um, if you don't have another route for them to go, meaning the only thing you rely on is pain, the next thing is, what's the next path for them? Being more active or less active? What's the next route for them? Nutrition and weight loss. What's the next route for them? Controlling a strength and conditioning program. Maybe they're a youth athlete and you finally got them out of pain. You're like, oof, where's the real route? You just need to get more flexible. Here's our new flexibility program that I design once a month, and you just come in and get reevaluated, see your progress, and move on. Now you're actually having an impact on their long-term health, not just their short-term health. So if you're looking to conquer pain, patient-centered is perfectly for you. If you're like, I'm looking for something different, I need a different path, I just don't know what those paths look like, then you start in those 4 different domains: fitness, home, work, and health. Understand that managing pain is just the start of the relationship, not the end. For most PTs, pain is the entire relationship. No, 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 no. Pain is the start of the relationship, not the end. And if you can help people understand that pain comes from somewhere, and if they don't fix this over time, it will impact their longevity, their health, their fitness, their work, their life. And nobody wants that. From a quality of life standpoint, pain is the thing that limits us. And for them to come see you, you and I have pain. It's somewhere in our body, right? Like right now, it's like my stiff back or whatever it is. People only seek out support when that pain interferes with their life. So it takes time for pain to interfere with people's lives. So just because you can get rid of it in 4 to 6 weeks doesn't mean that you really solved it. Something led up to it for weeks to months to years. And yes, you solved that, but that's the first layer. Now figure out truly how you can keep it from coming back. But that's having a different stream or a different path for them now to go towards. And for most PTs, that's where we get stuck. We're like, well, you really don't think about it. So you're like, well, I'll see you whenever you have pain again. Famous words of a discharge. Let me know when you have pain again. And I think that that's really going to limit. That's why I say the title of this podcast is uh, Patient-Centered Approach is a Disservice. Yeah, it's a disservice to the patient. It's a disservice to the person truly behind it all. So get rid of the pain so you can start working on the actual problem. Have different paths for people to help. If you focus on the body part, you'll always be patient-centered. And I think this is a wheel. Like you're just constantly developing this skill to take them to the next level. So they don't feel like they're an actual patient, they're actually impacting their lifestyle. So it's just this wheel that you're always working on. I've explained them as dials, whatever you want to call them. But ultimately getting your lens to come away from the body region and into their entire lifestyle. How can we take them to the next level? And after doing this, this is how I treat every single patient, every athlete. I'm always working on this. And it's amazing the impact you can have. And believe me, I have a lot of patients that are with me for life or throughout life. Why? Because it's constantly evolving to help them to the next level, just like in your career, right? Let me explain this. A CEU course, a 2-day CEU course is the equivalent. I know you've been looking for some education. Here's some things that I know you're probably not going to use and you'll forget across the day. My vision is to be able to help people across their career path. Why? Because you're always going to have challenges. Yeah, I solved the taping class, but now I need to understand manual therapy. And once I understand manual therapy, I'm going to fix it. No, you're not. Now you have to understand acute management. Like after acute management, you have to look at complex cases. And now you have to talk about blood flow restriction and all these other things. These are all simple tasks. That's the same as body parts. And once you get at taping, your manual therapy, your blood flow restriction, your exercise, your flexibility, these are all simple things, but still at some point you have to be able to put together. And my vision for clinicians is to help put those together, and that it's not just about the body part. It's not just about a CU course. It's not about that. It's not patient-centered. It's not PT-centered. It's person-centered. And if you can understand that your job is to bring a patient, a person from pain into that next path, you have to have a different pathway. So for clinicians that mentor, I get that. Yes, you wanted the acute injury management, but at some point you have to attack the real problem, which is you can't design strength programs. You can't design strength programs. You can't get them fit. If you don't understand fitness principles, you can't get them back to sport. You can't get them back to sport. You don't have outcomes. But yet you're still focusing on exercises because that's the path of least resistance. It's the easiest thing to do. You always blame it on the exercise or clients or whatever it is. At some point, you have to have different paths. And if you don't have different paths, you always go to the path of least resistance, which is what you know. And that's all, orthopedic PTs will stick with. That's the only path that they understand. So that's patient-centered and treat the same shoulder over and over and over again. If that's for you, great. If it's not for you, let's go. Let's party. So that's I wanted you to understand people is who you need to treat, not the patient. Okay. So for those of you trying to go to that next level with what you're doing, and if you find yourself stuck and you're like, well, where do I start? Honestly, strength and conditioning is the thing that will bridge acute pain with orthopedic pain with chronic pain. I truly believe that in all skill sets you can do, it doesn't matter. The manual therapy, McKenzie exercises, Mulligan, all those things are great for managing pain. But what happens when they're out of pain and how do you fix the root? Truly, any form of exercise, lifestyle changes, strength conditioning, any form of athletic performance, weight loss, whatever it is, it's all managing volume and intensity. And if you can't do that, you'll always be stuck in that. So that's why I tell people just join my strength and conditioning summit. Why? Because it's the gap that most people have because they don't know how to have those conversations. They don't know how to outline the program. They don't even know where to start. So they'll ask the patient the question like, "Oh, you want to join the strength program?" And they're like, yeah, sounds fun, but nah, I'm good." And so what you need to do is learn how to outline that for them. You have to be able to design that, show them the steps so they can actually understand and comprehend and see something on paper and be like, oh, that makes sense to me. And there's a way and an easy structure that you can do to help people progress to that next level. And the way you're currently doing is probably short-sighted and it's not getting the results that you want. So whether you're frustrated, don't know where to start, you're an expert and you want to refine, doesn't matter to me. Come join me. It's actually this weekend, whenever you guys are listening, is 2023, June 10th and 11th. It's all virtual. I love to see you inside the group. I want to celebrate. We actually have somebody from outside the United States. We have somebody from Greece coming into the course. I think we have one chiropractor, a couple massage therapists, and the majority PTs from all over. I think we have 6 states at the moment joining us virtual. So we've got a huge party of clinicians who really just want to make an impact at a large scale. So if that's for you, I'm excited to see you inside the course. Join me, drchrisgarcia.com/summit. If not, send me an email, drchris@drchrisgarcia.com. Otherwise, I will see you guys on the next episode. All right, take care. See you guys.